carried out this study because although many cohort studies have examined mortality among children and young adolescents living with HIV and receiving antiretroviral therapy or ART, there has not yet been a comprehensive systematic review synthesizing all these findings. We conducted a systematic review searching PubMed and Embase and used a meta-regression method to analyze mortality data across several dimensions, including region, age, sex, CD4 count, which is an indicator of the strength of the immune system, and treatment duration. We also performed a sensitivity analysis by restricting our analysis to high-quality studies and found that results were similar regardless of whether all studies or only those of high quality were included. We found that HIV-related mortality rates among children and young adolescents have decreased over time. However, the mortality risk remains highest among the youngest children, especially those under 1 year of age, as well as for children who started treatment late at low CD4 counts and within the first 6 months after initiating ART. Regional differences persist, although these gaps have narrowed over time. Key factors influencing HIV-related mortality include treatment duration and CD4 counts at treatment initiation. Let's take a look at the results for male children aged 3 to 4 years in sub-Saharan Africa. In this first chart, we see that when children in the lowest CD4 category received ART for up to 6 months, mortality per 100 person-years dropped from more than 30 deaths in Central Sub-Saharan Africa, shown in light blue, and just over 10 deaths in Eastern Sub-Saharan Africa, shown in dark blue in 2000, to less than 8 and 3 deaths respectively in 2020. As shown on the x-axis of all charts, as CD4 counts improved, fewer deaths occurred. When ART was given for 7 to 12 months among children in the lowest CD4 group, deaths fell from a little over 6 in Western Sub-Saharan Africa, shown in red, in 2000 to fewer than 2 in the same region in 2020. When children in the lowest CD4 group received ART for 13 to 24 months in Central Sub-Saharan Africa, shown in light blue, mortality rates per 100 person-years fell from under 3 in 2000 to less than 1 in 2020. In Southern Sub-Saharan Africa, shown in green, the corresponding mortality rates decreased from approximately 0.7 in 2000 to 0.3 per 100 person-years in 2020. Altogether, these results demonstrate significant progress in reducing HIV-related mortality among children and reinforce the value of early ART initiation and long-term retention in care. Geographical variations in HIV-related mortality rates have historically been substantial, although the differences between regions have narrowed over time over the period from 2000 to 2020. For example, in 2000, regions such as Central and Western Sub-Saharan Africa had much higher mortality rates compared to other areas. By 2020, these rates had declined and the gap between regions was smaller, although some differences remained. Our results suggest that, despite progress, sustained global support is essential to maintain and build on these gains. Strengthening efforts to prevent vertical transmission and ensuring HIV testing for all exposed infants remain critical. Initiating ART promptly, ideally at higher CD4 counts, along with supporting long-term retention in care and adherence to treatment, is key to improving survival.